Cement, especially Sarah Plummer, in finding a good plan for the employees of CTS Cement for the first time. We're really excited and honored to be working with you. What we have here is an enrollment system that will be launched to you if it hasn't already been. I think it already has been, actually. Okay, so we've sent a welcome email, and we've heard back from a lot of people that it's pretty easy to figure out. But still, I wanted to walk through the enrollment system and what the benefits are and how you look at the costs, and explain to you a little bit about how to find a provider in the plan, as well as how a health savings account works. Now, this is not your only opportunity to get help. Anytime you need us, just give us a call. Our toll-free number is 877-872-2080, and we are also available at hq@morebenefits.com. Here's our website. If you ever lose the link on how to enroll for More Benefits, it's just More Benefits with 2 O's. This employee navigation, that is the same site where we enroll. And then here's our phone number. You can call us. And then, like I said, the email is HQ. You can also just put in here, in this call for help window, put in your name and your question, and that will come to us. This is actually Alex here, since he's so pretty. So anyway, once you get started, it'll say, welcome to Employee Navigator, start. You have 8 days remaining. Now, there's no need to wait till the last minute. If you have any questions or issues, please let us know, and we will help you through it. But we do have to have all of the enrollments in by December 8th, or else nobody will have their ID cards on time. This is a really busy time of year for the insurance carriers, so we want to get a good head start. Okay, without further ado, you will come in, click Start. First thing to do is to just verify that your name and date of birth is correct. We have the Social Security numbers masked, but we're pretty sure that we have the right address for everyone. Your address, your home phone is optional. Usually a cell phone is good to have there in case we need to reach you about a claims issue or provider question you might have. And your primary email will already be saved in here, and you can change that too if you'd like. So once you do that, you go to the next page. Now, we don't have any dependent information, but if you have dependents that you want to add, this is the step where you add them. So, for example, if you have a spouse, you would go in and put in their name, the relationship, their date of birth, the Social Security number is required only for adults. You don't have to have it for your children, but we do need it for adults. And then we don't need to know the college student or any of this like that. If there's a different address, that's where you add a separate address. Otherwise, you just say home, and it keeps the same address that you have. If you have any other dependents, then you keep adding dependents. Maybe you have a child. The other one? Okay. So you add in the child. Okay. And what that's going to do, that doesn't necessarily mean you're going to cover them, but at least it gives you the opportunity to see what it would cost if you did cover them. So you save all of that. Now here is the part where you can see the medical plans. So you see here the full PPO HSA for out-of-state employees is $0 if it's just for the employee. If you add in the spouse, then it's going to fetch the rates and tell you that it's $177.98 per pay period. If you add your child, you have full family, then it pops up to the $260.13 per pay period. If you want to see the details of the plan, you just click that detail button, and it gives the plan design. So let's just talk about this for a minute. The deductible is listed first. There's a deductible for an individual and a deductible for a family. The deductible is the amount that you would pay out of your pocket before the plan pays anything. So it's just like if your car gets wrecked and they say, oh, you have a $500 deductible on this $1,000 claim. That means you have to pay the first $500. Well, in this case, if you are an employee only covered, then your deductible is $1,800 for in or out-of-network doctors. But if you have a family covered, the plan doesn't pay at all anything except for preventive care, and I'll get back to that in a minute, until you've met the family deductible. So if you have you and your spouse, then the deductible is $3,600. And that could be you and your spouse or in the children, however many people are in the family hitting $3,600 combined, or the first person hitting $3,600. So it's definitely not an embedded deductible like you see on a lot of plans where the first person hits a deductible and the plan pays, and then the next person. The way this works, the individual, if it's an individual only, then it's $1,800. But if there's more than one person covered, then the deductible is $3,600. So hopefully that's clear. Please feel free to put your questions in the question button over here. I see that there's already been a question. Let's see. Oh, that's somebody. Okay, somebody asking if we've started. Okay. Next is the co-pays and co-insurance. Oh, I'm sorry. A second thing is the out-of-pocket maximum. The out-of-pocket maximum is your stop loss, your worst-case scenario in any given year. For an individual who's covered, the most that person would pay for all of the health insurance claims for doctors and hospitals and drugs for an in-network provider or providers would be $4,000. So, for example, if somebody went into the hospital and incurred a large claim of $50,000, something like that, the member would pay the first $1,800, and then for hospitalization, they would pay another $100 plus 20%. So now they're $1,800, $1,900 out of pocket, and then 20% of the balance up until they're out of pocket, the member, the patient, yourself, has paid $4,000. After that, Blue Shield pays everything. Your claim will be covered at 100% after your out-of-pocket maximum. If you're a family and one member or a group of members together reach this $3,600 deductible, then they would pay 20% for whatever services they use. The insurance pays 80%. Once the out-of-pocket for the family reaches $8,000, then the plan pays 100%. So that's the maximum out-of-pocket. I do caution you to stay in network because you can see that the out-of-pocket maximum doubles if you're going to out-of-network physicians. And one of the things that I've noticed is that the most common issue is that an anesthesiologist, if you end up going into the hospital, you know, it's easy to figure out who the in-network hospital is. It's easy to pick a surgeon who's in-network. You know, you have time to plan, hopefully. But then the anesthesiologist pops up, and they're out of network. So as you're doing your planning, please be aware of that. Okay. So the next thing is the how does the plan work in terms of preventive care? So as you can see, everything is subject to the deductible, whether it's primary care, specialists, lab services. This is a PPO, so you don't need a referral for specialists. Chiropractic care, even chiropractic care, even though it's covered, it's subject to the deductible, and it does cover up to 20 visits. So everything is after the deductible, including prescriptions. So after you hit your deductible of $1,800 or $3,600, then you have a $10 copay for generic, $25 for brand, $40 for non-formulary brand. And then they also have mail order prescriptions where you can get a 90-day supply for double the copay. After the deductible is met, then you have your copays, and then all of your copays go towards your out-of-pocket maximum of $4,000 and $8,000. So that is how the plan works. Deductible, co-insurance, and then the out-of-pocket maximum. Your premiums, of course, don't go towards your deductible or out-of-pocket maximum. The premiums that you pay are taken out of your check on a pre-tax basis, however. So if you choose to enroll in this plan, your paycheck will be reduced by whatever your deduction is if you're covering dependents, and then your taxes are calculated after the deduction, which saves you a little bit of money. The thing is, now that we're doing this on a pre-tax basis, we will be locked into our elections for the whole of the plan year. So you won't be able to add, drop, or change your coverage for the whole year. Starting January 1st, this plan will kick in, and then you'll have an option sometime around this time next year to make changes. So some of the common things that happen are that they have a spouse or a child, but though that person may have other coverage right now. So if they do have other coverage, you can go ahead and not cover them now. And if they lose their other coverage, maybe the spouse is retired or changes jobs, then you would be able to enroll them during the middle of the plan year, as long as you let us know within 30 days of that event that caused them to lose coverage. So qualifying event would be like a marriage. If you get married, you can add your spouse. Divorce, drop the spouse. Have a baby, add the baby. But then another thing might be that you know, like I said, maybe you're covered under your spouse, or your spouse is covered under their work. They lose coverage. You let us know within 30 days, and then we can make changes. Okay? So once you decide who you're going to cover under the plan, you simply select the plan, and they will indicate that the effective date is 1/1, and then you save it, and that's it. We don't have any other benefits right now. You know, the first year out, we wanted to focus on the medical, so you just indicate here that you, as an eligible employee, you understand that everything is here is correct, and that the elections are deducted pre-tax and cannot be changed unless you experience a qualified event. And then here's a list of what all the qualifying events are, and so you can see what they are. And if that happens, please let us know within 30 days. So that's it. In this case, we realized that we enrolled the spouse but not the child, and then you just hit agree and complete. And once that's done, you can print your enrollment summary or go back to your home page. Within the home, let me close this. Okay. Now here's some documents that you might find interesting when you get in there. There's an overview of the benefits that we just reviewed. There's a notice of exchanges. So the Affordable Care Act provides for insurance exchanges, which are set up state by state, but in the case of 36 separate states, which you may belong to, there is a federal exchange. One thing to be aware of is that if you were receiving subsidies under one of these exchanges, now that your employer is offering a health insurance plan, you will no longer be eligible for those subsidies. So then if that's the case, then you will want to enroll under this group plan or buy individual coverage without a subsidy. Now, one thing that's pretty common in America is that the children may be enrolled in a Medi-Cal or Medicaid program. Those are not, that eligibility is not impacted by your being eligible for a medical plan. So just based on whatever your household income is and your children's circumstances, you may be able to continue with that Medi-Cal or Medicaid plan for your children and then enroll on this plan for yourself. And you'll see that we've attached some documents, how to find a provider, a more detailed overview of your benefits, and some guidelines for preventive care. So I want to start with how to find, we'll go through those in a little bit more detail. First I want to show you how to find a provider. We are in Blue Shield of California. So funny, throughout the nation, Blue Cross and Blue Shield are a combined entity, but in California we have Anthem Blue Cross and Blue Shield of California, and they're two completely different and competing entities. So you'll have instructions on how to find a provider, but I can just kind of walk you through it. BlueShieldCA.com. The reason why I wanted to take you there first is because once you receive your ID card, you'll have information so that you'll be able to register under Blue Shield. When you register under Blue Shield, you'll have access to provider links to look at explanations of benefits, and also to access a health savings account that you can set up that will correspond with your high deductible health plan. You scroll down here, looking for a doctor, and so let's say that you live out of state. So let's say you live in Denver, Colorado, and you want to find a doctor. Well, it's going to take you to this other page. Am I on the right page? Yes. Okay. So it says, do you want to log in or register? So are you sure I'm in the right place, Alex?
Yeah. So unfortunately, the first time you do this, you'll have to kind of go through the California website. But once you do it the first time, you can save the link. So we're going to show you the steps how to get to the link. So the first step is you've got to select a plan. So you're going to choose 2015 employer group plans with 51 or more employees. Then it wants you to select a sub-plan, which we have a PPO HSA. Then you're just going to go ahead and set the plan. And then go ahead and type Denver, Colorado, or whatever city and state you're in, and hit Find Now. Okay, and then what it's going to do is it's going to provide you with this blue card doctor and hospital finder so that you can search wherever you are. So this is actually the link that you can save right here, provider.bcbs.com. Okay. And then since we're already getting a group set up, we have 3 letters that indicate which network you're part of, and that is XEA. Okay, so you will not have to select a network because you've entered this 3-digit code.
X is in X-ray.
E is an elephant, A is an apple. Okay. And then you can search by name or specialty, or you can search by location.
All right, so here are 200 matches within Denver, Colorado. And then from there, you just add filters to look for patient ratings, accepting new patients, or any other type of filter that you have here. The good news is that the carriers are starting to allow for the patients to rate the providers and to get some idea about who's good and who isn't good. That is how you find a doctor in the Blue Cross Blue Shield Network, provider.bcbs.com, and it's code XEA. The other thing that we want to talk about is preventive care. There's a flyer here that will give you some ideas, but preventive care includes things like your annual physical, pap smear, mammogram, colonoscopy, and the labs that go with those things, as well as immunizations like flu shots and children's immunizations. But the thing to remember is once you log in, to look at what the guidelines are, because your doctor may be prescribing preventive care that's preventive for you, but it doesn't follow the national guidelines. For example, it used to be a pap smear was covered every year, but now it's every 3 years up to a certain age. And then another big kind of disappointment that we've seen from people is whenever they go in for a colonoscopy, they find that the colonoscopy isn't covered preventive care because during the procedure polyps were found and they removed polyps, which then changed it from a preventive exam to a diagnostic procedure. So when it's time to do those kinds of expensive things like that, it's really good to find out ahead of time what your costs are going to be so that you won't be surprised later. The other thing we wanted to talk about is urgent care versus emergency room. The urgent care is something where they have evening and weekend hours, but it's in a lower cost setting than an emergency room, which is in a hospital. There's really 2 reasons. Number one is cost. The average cost for an urgent care visit is $100 to $125. The average cost for an emergency room is $1,500 to $5,000. And the second reason is time. the average wait time is an hour in an urgent care center, and it's 8 hours in an emergency room. And just because of the way that the patients are triaged, when you go into an emergency room because your baby has a high fever, it's not going to be who got there first. It's going to be who is more critically ill. So if you have time to think about it, then perhaps an urgent care center would be the right place, as long as it's not life or limb threatening. The other thing, too, is with Blue Shield, there's a 24-hour nurse line, and you also, can go to the, we didn't talk about the teledoc.
No, we didn't.
Okay. No. Okay. So anyway, so that's urgent care versus emergency room. Just wanted to give you that tip. The other thing is, what is an HSA? So I wanted to ask if anybody has been involved in a health savings account before. It's a little different than a flexible spending account. It is paired with your high deductible health plan, and it allows you to put aside money on a pre-tax basis to cover things that are subject to the deductible, or even things that aren't even covered by the health plan but that are covered. Yeah.
Okay, so the HSA plan that you guys will have is going to be through Health Equity, and you don't have to go through Health Equity, but they have a partnership with Blue Shield, so that if you do choose to go through them, the fees will be waived. Okay, so here's a flyer about kind of what the HSA is. Okay, now when you enroll, Health Equity will contact you, and they're going to help guide you through the process, but we're always here as well if you have questions. So on the HSA, as Kelly said, nothing is covered before the deductible, which means when you go in, you're going to have expenses that you're going to have to pay out of your own pocket. So with the HSA, you can set aside your own money into an HSA account and use that money to pay for your visits. Okay? Now, the health savings account, it's basically a savings account that you open. It's in your name, and you receive a debit card. Okay? The money that goes in there is a write-off on your annual tax return, so it will reduce your taxable income, and then you get to use that tax-free money to pay for your medical expenses. Okay? So in the year 2015, the maximum that you can put in the account is $3,350, and that's the amount that you would be able to write off. But if you have a family, you can actually put double that, $6,650. Okay? So this money rolls over from year to year. So if you do not use it, like let's say you fund, it's just you on the plan, and you fund the whole $3,350, but you don't even go to the doctor once except for maybe your preventive care, which is free. Well, you don't lose that money. It sits in that account, and it builds interest just like in any other savings account. Okay? And then the next year, you can actually fund it again. So you can see that over time, what you're doing is you're building a nest egg. That way, if something ever were to happen, you have the funds set aside on a pre-tax basis to pay for it. Okay. Now, the account, I know we don't have dental and vision, but you can still actually use money in that account for any qualified medical expense. And that includes things like glasses, vision coverage, your dental exams, maybe you get a cavity, you can pay for all of that stuff with your HSA money.
There's a publication, irsgov.pub 502 PDF, for a complete list, and it includes things that maybe aren't even covered by the health plan, like Alex was saying, whether it's, wheelchairs. It's got medical, dental, vision, all sorts of things. Here's a PDF that you can use. Now, the one thing to keep in mind is if you are enrolling employee-only coverage, then you can only contribute this amount into your health savings account. That being said, once the money is in there, you can spend it on any qualified expense for any person in your household. So even if you're covering just yourself on your medical plan, you can still put in $3,300, or I'm sorry, $3,350, and use it for your children's braces if you need to. So that's kind of interesting. This is a very, very good tax write-off, and it's a way to pay for things that you would have paid for anyway on a pre-tax basis.
Yeah. The one thing that you can't do with this money is use it on anything else that's not a qualified medical expense. Once it's in the account and it's funded, if you try to go shopping with it or buy Christmas presents, then you're going to end up having to pay the normal tax rate plus a 20% penalty. Okay, so definitely only use that money or set aside money that you can, make sure that you won't need to touch.
Yes. So, and you, whenever you go into Blue Shield's website after you get your ID card and sign up, that is where we're going to have this HSA plan accessible, so that you'll be able to get onto it 24/7. And they have a chat, they have 800 number to help you figure out how to use it. But this Visa Health account card is really going to make it easy to get to the money. And how do you get the money in? Is you have to arrange that yourself. So, yes, you have a, let's just say, okay, I see I have a question. CTS doesn't have dental. Can you add dental plan? No. Okay, so that's a good question. There is no group dental, life, or vision plan being offered at this time. And so you would be able to buy individual dental plan if you want. I think, I heard Sarah telling somebody yesterday, like ehealthinsurance.com is one option.
Yeah. You guys also have AFLAC plans. So there is an AFLAC policy that's dental that you could purchase. So that would be another thing. Hopefully down the road we can start adding things, but this year we focus on medical. That's the most expensive and the most important of all of the products. So
yeah, one thing at a time. So the other thing, I guess, I didn't realize how easy it would be to show what these PDFs look like. This is the urgent care situation and the emergency room situation. So you can see sprains, strains, sports injuries, cuts and abrasions, fevers, colds, sore throat. Those are good for urgent care. Emergency room is chest pain or heart attack, stroke or weakness, fractures, severe bleeding, anything like that. And then there's always going to be an 800 number to find the closest urgent care center or emergency room. And then there's also another number. These numbers are going to be on your ID cards, so that if you're out of your service area and you need to receive care, then you'll be able to find that. What else? So we talked about how to find a doctor and HSA. I think that's about it. Now, what I want to do is open it up for questions, and we have 14 attendees. I'm going to unmute, and we'll see if there's any questions that we want to share with the group. Okay? I'm unmuting you.
What if you don't want to switch doctors? What if you want to go to the doctor that you already have gone through to for 20-some years?
Question. Happy to check. Did you already look to see if that doctor was in the network?
No, I haven't. But
well, that would be the first step. We would want to see if that doctor's in the network, because it's quite possible that they are, which would mean that you wouldn't have to change doctors. If not in the network, which would be a bummer, then you would still be able to go see that doctor, but it would be on an out-of-network basis, and so you would end up paying a lot more out of pocket.
okay.
Do you have the doctor's name, or you may not want to share it publicly? You can always email.
He's Dr. DeForest in Beecher, Illinois.
E-F-O-R-R-E-S-T?
O-R-R-E-S-T.
Okay. And where in Illinois?
Beecher, B-E-E-C-H-E-R. Beecher, Illinois. Right. There you go.
Okay. I wanted to do this so that you guys could see how easy it is to look up a doctor. It's thinking.
It's thinking.
Yes. No providers were found in your requested search radius.
Oh, maybe just open it up.
So there's no providers within 25 miles of me?
No,
Yeah.
we were searching for a specific doctor.
Oh.
Oh, here, okay. Is it, you know, I spelled it wrong. Here it is, John DeForest.
Yep,
Seven-
that's it.
Okay, he's in network.
Okay, fine.
You don't have to change doctors.
I'm good.
All right. If there are no other questions, I'm going to go ahead and stop this and stop the recording. This will be out there if anybody wants to see it who wasn't here. Don't forget that you can always just call us with individual questions, 877-872-2080 or hq@morebenefits.com.